Welcome to MediKorea. In today's video, we shall have an interactive session. Today, I am hosting two beautiful ladies from a different country. As usual, my name is Emmanuel Oriada from Uganda, East Africa, and I'm hosting two ladies from Italy. On my right, we have
Arianna.
And on my left,
Alessandra.
Oh, yeah. So today, our discussion is going to basically focus on what we can learn from each other as Uganda and Italy. I met these two beautiful ladies while I was having my rotation in St. Mary's Hospital, Lacho, and we kind of got into a very wonderful professional relationship, and we decided to have a chat about what we can learn from each other. But perhaps before we dive into that, maybe we can have a little bit of understanding on how did these two wonderful ladies end up in Uganda? Did they just drop from the sky, or they came and so I don't know who goes first. Maybe Ariana can tell us about how the program that brought them to Uganda.
Okay, so we came to Uganda with an exchange program of our university in Italy, which is called Exchange Extra European Union, and it permits you to have a period of studying or both studying and traineeship in the hospital in a country outside Europe. And we applied for this last semester in March, April-March, and then we got this opportunity to come. They confirmed us in July, and then we start organizing it, and we arrived here 1 month ago. Yeah.
Oh, that's great. Did you mention that it's an exchange program?
Yeah.
Would you mind if I get exchanged with for you? As you come to Uganda, I go to Italy? Or
I don't know if the Gulu University is okay with this. You can come. We can host you in our university in Milan.
Yeah.
Well, that would be a very wonderful thing, but I don't think we've thought about it yet. So I think I should bring it up. Maybe do you have anything to add on what Ariana said already?
No, I think that's all. We always wanted to come to Africa, and so it was like a dream.
Oh, it was like a dream.
We are glad.
Yeah. Our university has this relation with the Gulu Hospital because also Corti Foundation, who is an Italian foundation and works with the Lacher Hospital. So that's why we have this contact and we came here.
Yeah, that's wonderful. And I believe you've had a wonderful time around Uganda.
Yeah, we are enjoying it.
Yeah. Did you find some things very enjoyable around here? Or what would it be if I was to ask you what did you enjoy the most in Uganda?
I think life in general, also people, because they are very friendly and always happy, and in our country they are not so friendly.
Oh, I see. Am I friendly too?
Yeah.
I thought I was harsh.
You host us in your
studio,
so you are friendly, of course.
Did you find time to maybe travel elsewhere apart from Gulu while you were in Uganda, or you went to Gulu?
We went to Murchison Falls and some other place around Gulu, but we planned to go to Kalongo, but
we are not
due
going.
to Ebola. We are not going. So.
Oh, I understand. Yeah. Sometime on social media, I saw someone crack a joke. Because some people think in Africa we keep lions as pets. Did you have that kind of thought when you're coming?
No.
That's okay. So for all the time you've been in Lacho Hospital, I believe you got in time to see a lot of things, how we do things in Uganda.
Yeah.
And I believe you've been doing some bit of comparison with what happens in Italy.
Yeah.
So perhaps let's start with what you've learned from how things are done in Uganda.
Okay.
What are some of the positive things that you think you've learned and that you can, advise people in Italy to adopt or,
Okay, so it's not easy to say because hospital in Italy and the hospital here are very different. I think the main thing we have learned by our experience is to listen to patients, to visit them, and to base your examination a lot of semiotics and less on radiological examination and on biochemical test. Because in Italy, we don't do as much as semiotics like on patients, but we do a lot of tests because we have more of them and we use a lot of them. We are not used to visit patient that well, to see everything of a patient, like examining every system. So I think this is the main thing we have learned from our experience in the hospital. I think Sandra can confirm.
Oh, yeah.
Yeah. Well, we had the chance to meet some diseases that in our countries are not that common, like malaria.
Oh, okay.
And also sickle cell disease. It's not so common in our country. And also the patients are different because here you have very young patients, while in our country we are used to see like 18 years old people or 90, and so it's different.
Are you trying to tell me that young people in Italy don't fall sick at all?
No, but it's not that common to see so many young people in the hospital. Yeah. So in Italy you like see patients with a lot of comorbidities, but they are not completely different. I don't know how to explain it.
I think I actually get the point, because she said that most of the patients in Italy are the elderly.
Yeah,
I think there are more chronic illnesses in Italy than there.
You suffer more from the chronic illnesses.
Yeah,
well, I see.
due to bad lifestyle, like a lot of hypertension, a lot of I don't know how do you say, obesity, COPD, stuff like this, due to smoking or stuff like. And here it's not that common.
Okay. Yeah. So have you tried to think about what could be the reason behind the difference? Have you observed some of the things that could explain this, or are you still, asking the reason why?
No, I think
in our country the hospital and the health in general is more accessible to everyone.
Okay.
And it's a public thing. We don't have to pay for it.
Oh, you don't have any private healthcare?
We have a private healthcare, but it's up to you if you want to go there or in the public.
But the public one is a good one.
It's very good, yeah.
For us in Uganda, it's the reverse, yeah.
We saw it.
The reverse, yeah. So the private facilities tend to offer a bit of better services than the public ones.
Yeah.
Lacho is quite good because it's a non-government organization. It doesn't receive the funding from the government. So government-funded hospitals are doing quite terribly bad. Yeah. But I'm really curious about why the young people in Italy are not that sick. Could that explain, or there is something a bit different about
Yeah. I think the reason are basically two. Here there are less elderly people. Like in Italy, it's like the main age is
majority
older.
Of the population are the elderly.
Yeah.
And then also because in Italy, in the hospital, you have different wards, like the cardiology wards, the pulmonology wards, the infectious disease wards. And for example, in the internal medicine ward, that's the one we are being on here. Yeah. You don't see all the pathology you see here, because they are divided into the specialties. So you can find maybe young people, but not in the internal medicine ward, because that's where just old people go.
So you people are quite specific with the subspecialties, whereas for us we combine, all cardiac cases, pulmonary cases all in one place. I see. We don't really have a lot of those subspecialized people. Most of our specialists, do generally internal medicine, surgery, general surgeons. We don't really have a lot of, subspecialized experts. Yeah.
Okay. So, but for example, if you go on hematology ward, on oncology ward, you can find young people also in Italy. That it's not like also young people got sick in Italy.
Yeah, but also I think another point can be that we have more like prevention things.
Preventive medicine.
Yeah.
While here I don't think it's so common.
Yeah.
It seems to me like, but you can tell me if I'm wrong.
No, you're very right about this. I think the difficulty comes from the patient-doctor ratio. We really have few doctors for the patients, so it becomes very difficult to give health education to everyone. But it's one of the reasons I actually started this, such that I can try to pass on information, such that even if I'm not physically available, someone can at least, watch me and learn something. Okay, so you people do a lot of health education?
Yeah, and also we do lots of exams of screening.
Oh, screening.
Yeah.
Screening.
Yeah. Also for example, for the women, the prevention of the cancer of the cervix. Yeah. Or we do lots of scan.
Ultrasound scan.
Ultrasound scan for we call them mammography.
Mammography.
Yeah. And it's a thing that it's done every year. Okay. And so they have
and the government pay for it. Like you receive an appointment and you have to go for free for these screening exams.
I'm getting a bit curious because you said the government caters for most of these facilities. I'm trying to think about countries like the USA where there is, obligatory, social health insurance. Yeah. Do you have that as well, or it's just the taxes that cover for all this?
No. Taxes.
The taxes. You don't have a compulsory insurance in your country.
No. You can have one for yourself if you wanna go for a private clinic and you got the insurance.
But your own choice.
Most of people don't have an health insurance in Italy.
That's very interesting. I see some answers already coming to the question I was about to ask, but it's interesting that you are really before I get there. Apart from what you've already mentioned, is there anything else that you think Uganda can learn from Italy in the healthcare system? Because I know you've seen the difficulties that we go through here, and I know you've observed the differences. What else could you do? Do you think that Uganda would do better with if we could copy it from Italy?
This is a good question, and not easy to answer, because maybe you can think about something that can change, but then if you have to do it, it's not that easy to change things. But we can try.
Yeah, you can simply give us something to think about, because sometimes if you don't think about it, you won't do it. Yeah. So you can try to open our eyes a little bit so that we can see a few things that we can learn.
I'm thinking.
You're thinking?
No. I have one thing. In Uganda, also in the hospital, but also outside the hospital, people never rush. It's always like, this is an emergency, and okay, we are going to take the blood, and doing things very slow. And sometimes I'm like, go faster. And in Italy, when you have an emergency, like everyone rush. If someone got like an heart failure, everyone rush to bring it to the hospital. If in the hospital you need blood, they are running and rushing to get it. So sometimes here, I don't know if it seems like people do not understand when there is an emergency. I don't know if you got my point.
I got that. And I actually believe it to be very true. We have a very big weakness there. Are you done thinking?
I think that I agree with Ariana, and I think that sometimes this can be explained by you have less resources than us.
That's very true.
But I think that sometimes they don't use the resources they have properly. Because also this morning they were telling me that there was an ultrasound scan that was broken in 1 week, and I was like, why? If they have so less resources, why they don't take care of them? And so
you're very right about that. We have a very weakness because we have few resources, but even managing them becomes a problem. I think some of the gaps come right from the training. Like what you talked about, the emergency sort of response. We don't really put a lot of emphasis on it, when you're being trained. I happened to also interact with someone from Germany, and she actually told me it's a full rotation, emergency medicine is a full rotation. For us here, we focus on the, obstetrics, gynecology, medicine, we do general surgery and pediatrics. We
yeah.
don't have special time allocated for emergency medicine, so we don't really get to appreciate a lot of this so much. We cover them most of the time theoretically, so we don't really have that, understanding of what an emergency is. So a few people that you see running around, perhaps they take a personal initiative to learn a little bit extra, or sometimes we get a chance to learn from a few training programs that are very short, 1 week, a few days, and then they teach you how to handle emergencies. But it's one of the weaknesses that we have in our training. And then when it comes to the equipment, taking care of the equipment. First of all, even the right people to take care of this equipment are very few. And the other funny thing is that the government doesn't employ them really, because we have equipment breaking down. They can potentially be repaired, but they can stay there years without being repaired. And even get even worse. So I think it's quite wasteful. We have a lot of redundant, things being wasted. And there are equipment that we have, but again, some of them we're not able to use. We're not able to use some of them. So it's quite a difficult thing. But I think the interventions begin right from the training and other interventions that the government should put on board.
But on the other side, you have talked us about using less resources in order to manage more problems. While in our country we are not so used, because everything we need is there, and it's difficult.
I actually learned that you do not use surgical instruments more than once. I use them once and discard.
It's different.
Whereas here we reuse them over and over. Even the gowns, we use linen and then we sterilize and use them over and over. These instruments themselves, we use them over and over. So that's quite a big difference right there.
Yeah, but another thing that we learn from you is like that you can learn by doing. In Italy, you study a lot, but you do, while you are a student, you do very not so much thing. You just study, and you can go in the hospital, but maybe you got the chance to go on just on a ward for a long period. So you got like hyper specialized also during your medical school, but you cannot see all of them, and you're not used to do things in all of the medical specialties. And here you are very good also. Also during medical school you can do a lot of things. You are good at it, and we are not.
Well, it's not that easy. It takes a lot of,
Okay.
It takes a lot of suffering. So
okay.
I'm not so happy about that.
Also about the surgical ward, if we are not interested in surgery, we don't get used to manage the instruments. Also, people who are the residents are not so free to do their work. Like there's a lot of jealousy from the elder one.
But
that's in Italy?
Because also I think that the reason is that in Italy you can just go on in theater and operate just if you are specialized in a surgical specialty. Like when you finished medical school and you are a doctor, you cannot go on theater and operate, but you can do like interns here. Do it, and also medical officers are not specialized, but they operate on theater. In Italy, you cannot do it, so the training takes longer, and
I actually also noticed that even before I met you. I got that also from the interaction with the person from Germany, and with other countries they are so strict, don't even use anesthesia, the procedure, even simple minor ones. But I think also it comes from the limitation of expert personnel, because the specialists you see, most of them are in Lacho Hospital and maybe in Gulu Regional Referral Hospital, the referral hospitals, and then the National Referral Hospital. But most of the facilities down there, you find the most senior person is the medical officer. And this cover a very large catchment area. And also looking at the distance away from the referral center, it's quite a long distance. So it becomes costly in terms of time. Sometimes referring this patient to go all that way.
Okay.
Perhaps you could lose them along the way because even the ambulances are not that good. You know,
Yeah,
the roads
yeah.
are not that good.
Streets
So
are
we are
not
basically
good.
trained to try and do as much as we can.
Yeah.
You know, even in those peripheral facilities. So you have to know everything. Know gynecology. Know this. Know the other.
Yeah, yeah.
So we are all over. So yeah, that's quite a difference right there.
Yeah. For example, in Italy, the anesthesia could be given just by a doctor,
Yeah.
the anesthesiologist, and it takes like 6 years of medical school
Yeah.
and 5 years of residency in anesthesia.
Anesthesia, yeah.
And here you have just 3 years of school of
We have anesthetists who do diploma courses
Yeah.
and it takes just 3 years. Yeah,
it's completely different.
yeah, it's very different. Yeah, so they are trained for 3 years and then they do more of the practice.
Yeah.
And then they can maybe work under the supervision of one true anesthesiologist. Though even our residence in anesthesiology takes a shorter time. You said more after medical school, how long?
5 years.
5 years. I think
Yeah.
it takes 4 years.
Okay.
And then you become an
it's the same.
anesthesiologist after that's in MED. Yeah.
Okay.
Yeah. Whereas here, we have a shorter duration and then you're out and then much of the work is done by the diploma holders under that person's supervision. Yeah. And you mentioned 6 years. The 6 years in medical school, like from year 1 to year 6, or does that include the internship?
No, it's like 6 years of medical school, and we don't have to do internship.
You straight away get licensed. Oh,
Yeah.
Interesting.
After the graduation, we got license. Yeah.
Wow. And you start touching patients.
Yeah.
Oh, that's very interesting.
Most of people in Italy after 6 years do start with the residency.
oh,
Yeah.
I see.
You just have to do a test, a national test, and based on your score, you can choose the residency you want to do. If you do the highest score, you can pick all of them, and if you do not that good score, you can just pick the one
the
that
one which has a lower cut.
Yeah.
Yeah.
And also the place in which you are
Yeah.
doing the residency depends on how high is your score.
Yeah, for
I see.
example, we are
Because-
from Milan, and Milan is very good,
Yeah.
and so the highest
It
score
depends on
wants
the
to go
field.
to Milan.
Okay.
Yeah.
So do you have any people who stay just general practitioners in Italy, or everyone wants to specialize?
Yeah, there are. The general practitioner are. They have to do a different.
Test.
They also
Yeah.
do residency in general practice, or just after finishing the
Yes,
medical
but
school?
they don't have to do the national test.
I see.
Yeah.
It's there's another way, and they have to go for 3 years of school.
Oh,
Yeah.
after
After
medical
the
school.
sixth
After medical
That's
school.
interesting.
Yeah.
Yeah.
But if you don't want to do a residency and don't want to do the general practitioner, you can do like work in, how do you say, like a general practitioner but by night.
Yeah.
Okay, you don't have to do any kind of school after medical school.
Okay.
And also work in
It's like a place where they keep elder people.
Yeah.
Oh, yeah.
I don't know.
Can't be.
I think they're called elderly homes or something.
Yeah,
Nursing homes.
Yeah, okay.
Yeah.
Or you
And
could
you can
do
work.
the doctor at a sports event,
Yeah,
stuff like this,
concerts.
but not so many things
Hold on
without.
a second. In your concerts, in your sports events, you have doctors?
Yeah.
Oh.
In what?
In your sports activities and in your concerts, you have doctors. They
Yeah,
have to be present.
yeah,
Yeah.
Oh, well, for us, we just go and have some fun.
yeah.
We're not worried about emergencies.
No,
Yeah.
Every time you do a sport competition, there must be a doctor.
Yeah.
Oh, I see.
Yeah. Also for the young children and
Oh,
up
I
to
see.
the
Older
older
ones.
one.
Quite a big difference also here.
Yeah.
We just go have fun. It goes wrong,
Yeah.
we have to run to the hospital.
Yeah.
Okay, thanks so much. I think that has been very interactive,
Yeah.
and I hope someone out there learned something. And
We
I'm
hope
really hoping a policymaker is watching this because we need change right here in this country. Yeah, thanks so much, Ariana. Thanks, Alessandra.
Thank you.
Thank
It's
you,
been very wonderful
Manuel. Thank you
hosting
very much.
And it's been very interactive. Yeah, I don't know if I'll see you some other time, but it's my pleasure to meet again. Uganda very
Yeah,
soon.
you can move to Italy.
Yeah, I can move to Italy.
We'll wait. Wait for
okay. There are people who move into other countries by fast marrying, such that they can.
Okay. Good.
Is that a good idea?
I don't know.
Can I pick on one of you?
We have to think.
Just to think about it.
Yeah.
All right. Right, so that's you know, some sort of rejection right there. But that's fine. I'll be fine. I'll be fine.
We cannot
so
say
much for
yes
coming.
Thank you,
at the camera.
You
It's
can't
just,
say yes, right now, so we shall do that backstage. And in Africa, well, we don't do it a lot these days. But back in the days, we used to marry more than one wife, so I could as well go backstage and propose to both
Okay,
of you.
okay.
I'm
So in Italy,
You too,
but
right?
yeah, in Italy you can marry both of us. You have to choose.
I have to choose.
Yeah.
But then I'll have to do it randomly, like close my eyes. Alright, thanks so much. And
Thank you.
I hope to
Thank you.
continue interacting with you.
Yeah, we
hopefully
hope
I'll
so.
host you online some other time. Yeah, thank you. Bye-bye.
Bye.